Welcome to the 7th Annual Occupational Therapy Golf Association Tour. Today we're studying the kinesiology of golf.
Cognitive skills are what every individual uses to process, categorize, and make sense out of what we see, hear, taste, smell, and touch. During golf, we put our cognitive skills to use every time we try to remember directions of a swing or proper stance. A golfer must have a strong attention capacity with the ability to focus, overcome distractions, to follow instructions, and to stay on task. While playing golf, the aerobic system is able to meet a large portion of the demands of standing and walking. Anaerobic power, on the other hand, is generated without the use of oxygen. It is utilized only when the body is being pushed as hard as it can go. In short but powerful movements, such as swinging a golf club.
The primary function of the respiratory system is to supply the blood with oxygen so the blood can deliver oxygen to all parts of the body. As you exercise, you breathe harder and deeper, and the heart beats faster to get oxygen to the muscles. When you inhale, the intercostal muscles contract to expand the rib cage, and the diaphragm contracts, which pulls downward to increase the volume of the chest. The pressure inside the chest is lowered, and air is sucked into the lungs. When you exhale, the intercostal muscles and the diaphragm relaxes, and the pressure inside the chest increases, and the air is forced out. It is suggested that while playing golf, you should take a full and deep breath, having the air gently fill your lungs. Then hold it for a moment and gently blow it out. This helps with the golfer's swing as well as relieves the tension of the golfer.
When preparing to place your phalanges on the golf club, the hands should remain relaxed. A person performing the grip should begin by placing the palmar side of their left hand under the club. The individual's hand should be in a medial position facing toward their body. The phalanges will then grip the club and a cylindrical grasp will be the product. These steps will be repeated for the right hand placement. The second digit of the left hand and the fifth digit for the right hand will overlap. For the right and left hand, the thumb will remain extended and the phalanges are flexed. The joints in the thumb are the carpal metacarpal joint, the metacarpal phalangeal joint, and the IP joint. The joint of the phalanges are the metacarpal phalangeal joint, the proximal interphalangeal joint, and the distal interphalangeal joint. These joints are assisted by extrinsic and intrinsic muscles to maintain the grip of the golf club during the swing. The extrinsic muscles originate outside of the hand, and they are the flexor digitorum superficialis, the flexor digitorum profundus. The activation of the flexor digitorum profundus flexes the phalanges at all joints. The flexor digitorum superficialis flexes the phalanges at the proximal interphalangeal joint. These muscles are activated when gripping a golf club. The intrinsic muscles are muscles that originate in the hand, such as the palmar interossi. These help keep the fingers adducted. For the grip, the phalanges need to be adducted and not abducted. The thumbs remain extended throughout the golf swing. The muscles that assist with thumb extension are the extensor pollicis longus and brevis. The constant hand usage in this game could lead to carpal tunnel syndrome. These constant movements result in inflammation, which make the carpal tunnel smaller, and this causes pressure on the median nerve. This nerve controls sensation and movement of the thumb and digits 2 through 4. The hand plays a major role in the game of golf.
The arms. The entire structure of the arm consists of 4 major bones: the humerus, the ulna, radius, and carpal bones. The humerus articulates with the scapula, the ulna articulates with the humerus, and the radius articulates with the carpal bones of the wrist. Together, these bones form the structure of a hinge joint, which is important to perform the golf swing. The muscles of the arm. There are a variety of muscles in the arms that are needed to perform the golf swing. These muscles consist of elbow and wrist flexors and extensors. Within these muscles are nerves that innervate them. These nerves include the radial, median, ulnar, musculocutaneous, and the auxiliary nerves. Together, these nerves make up the brachial plexus. When performing a golf swing, the golfer's elbow is in extension. The muscles helping and keeping the upper arm in extension is the triceps brachii. The muscles that extend the forearm and the wrist are the extensor carpi ulnaris, extensor carpi radialis longus, and radialis brevis. While in holding the club in extension, the arms are supinated due to the supinator muscle. When bringing the arm up to swing the golf club, the arm is in a flex position. The muscles that assist in elbow flexion are the biceps brachii, the brachialis, and the pronator teres. When the forearm is flexed, it is put into a pronator position due to the pronator quadratus.
During the backswing in the right hand dominant player, the right scapula retracts and the left scapula protracts as they move in a clockwise motion. The subscapularis facilitates internal rotation. The combination of left shoulder girdle rotation and scapular rotation in a counterclockwise motion around the trunk leads to large activity in the left medial scapulae stabilizers and retractors. During the acceleration phase, the shoulder girdle is the most active. The left arm maintains concentric contraction, which controls arm abduction and external rotation. On the left side, the levator scapulae assists in scapular tilting.
We'll be right back after these messages. The OTGA Clinic, helping with all your golf-related injuries. Call today.
Good morning, Mr. Tucker. I am Ann Reeder, your occupational therapist. We provide treatment today. So, I see that you injured your shoulder recently. Can you tell me how that happened?
I was out there on the golf course and I was doing my basic swing, kind of reach back. Right when I reached back, I got this sharp pain in my shoulder. I didn't really know what it was, but it pretty much hurts. Can't very much golf the way I want to.
Okay, golf. All right. Well, we're gonna get that squared away for you. First, we have to take off this slip.
The most common golf injuries are rotator cuffs, tendonitis, and back pains. Intervention plans include using weights to promote strength, occupational-based activities, and many more. For more information, please contact us at 334-555-OTGA. That's 334-555-6842.
The back and trunk muscles used in golf include the latissimus dorsi, the trapezius, the rhomboid major and minor, and the external and internal obliques. The back muscles are used in golf to improve posture, for ease of rotation, and to give power through acceleration. The spinal column is the bone structure associated with this area. The upper back muscles rotate the trunk and lift the golf club. The lower back muscles help rotate the trunk and maintain the swing position. The trunk muscles are the core muscles used for faster turns and stored torque. The bones of the trunk include the ribs and the sternum. The latissimus dorsi plays a key role in the powering of the golf swing, and its range of motion is critical for a correct golf swing. If its range of motion is limited, then the golf club will be out of position at the top of the back swing, resulting in compensation, inefficient swing mechanics, loss of power, inconsistent ball striking, and potential for injury. The trapezius has three functional regions. The upper region supports the weight of the arm, the middle region retracts the scapula, and the lower region medially rotates and depresses the scapula. The rhomboids major and minor are responsible for rotating and abducting the scapula. During the swing, the initial motion is initiated by the rhomboids, while the other muscle groups begin to take over during later stages.
During golf, the power of your swing is derived from your pectoralis muscles. Not only is your chest the power source of your swing, but also a key factor in keeping your overall form intact. You compress your sternum when getting in position in order to keep your shoulders tight and upper body squared.
The external and internal obliques help with the loading of the swing. The obliques coil towards the top of the backswing. They elongate to achieve the correct position at the top of the golf swing. Rhomboids major and minor are responsible for rotating and adducting of the scapula during the golf swing. The initial motion of the swing is initiated by both the rhomboid major and minor.
The hip is a ball and socket joint which connects the head of the femur to the acetabulum of the pelvis. Actions that are produced by the hip are flexion, extension, adduction, abduction, and rotation. The hip rotators are the piriformis, gemellus superior and inferior, obturator internus and externus, and the quadratus femoris. During hip rotation, the hip assists in the arms in producing a powerful stroke. If these muscles do not stretch, then the range of motion inside the hip socket will decrease and the pressure will increase. For a golfer to maintain length of the swing, the extensor and lateral rotator of the hip is the gluteus maximus. Its main function is to separate the legs away from the midline of the body. It gives the thighs the ability to rotate and provide stability of the pelvis. Tightening this muscle prior to and during the swing keeps the body still, along with slight flexion of the knees. The gracilis and the abductor muscle also assist in this motion. Both muscles stabilize the leg and pelvis, which allows power in the golf swing from the ground upward. The quadriceps consist of the rectus femoris, vastus intermedius, vastus medialis, and vastus lateralis. Their function is to maintain the knee position and help with the rotation of the hips, but mainly for the extension of the knee at its joint. The hamstring muscles are the biceps femoris, semitendinosus, and semimembranosus. They are needed to keep muscular balance and correct posture. These muscles extend and immediately rotate the thigh, typically shown when a golfer executes a swing. If injured, they can cause lower back pains, abnormal gait, and postural imbalance. The knee is a hip joint that allows all flexion and extension. The collateral, anterior cruciate, and posterior cruciate ligaments help to support the knee. The collateral runs along the side of the knee. The ACL and PCL provide limit rotation, forward and backward motion of the tibia. The knees allow a great amount of rotation and force throughout the swing. During the golf swing, the position of the knees shift, aiding in the weight bearing from either side. The gastrocnemius is a primary leg muscle used in golf. It is needed to plantar flex the foot after the swing has been executed. Its origin is the medial and lateral condyle of the femur and inserts into the posterior calcaneus via the calcaneal tendon.
The feet are important factors within the golf stance. The individual playing golf will be on the balls of their feet. The placement of the feet should be in shoulder width apart before the swing. The feet will remain in this position until the backswing. During the backswing, the left foot will shift all of its weight to the great toe, and the right foot produces the movement inversion and plantar flexion. The muscles that produce inversion includes the tibialis posterior, flexor digitorum, flexor hallucis longus, and tibialis anterior. The muscles that assist in plantar flexion are the gastrocnemius, soleus, plantaris, and flexor digitorum longus. These are the muscles that contribute to the movement of the foot in the game of golf.